Sunny fall morning to stand up for working people and for the benefits that we have bought and paid for. That's what this is all about. What's at stake, frankly, is across the board cuts to a lot of important programs that we rely on over the next 10 years. And we're here to say that enough is enough, that we are not going to be sacrificed on the altar of fiscal responsibility when we've had two unpaid for wars and tax breaks to the wealthiest folks that don't need them, while we're cutting programs to the people that do.
Our last rally where we were holding Kathy McMorris Rogers accountable. During our last event and rally there, we caught Kathy off guard with about 30 plus individuals. We packed into her office, took up a half hour of her time. During that conversation, I know many of you were there, but she in front of all of those people that were there sharing their concerns with Medicare and cuts and the possibility of these going into effect, she went and told us that emergency rooms was adequate health care for us.
I'm Mike Foley. I'm the president of the Spokane Building Trades in town, and as members of the building trades, we cannot and will not stand for any benefit cuts to the Social Security and Medicare system or to cut the Medicaid system. In a couple of weeks, some legislators will be pushing to raise the retirement age for benefit, and this will not happen under our watch. The scopes of work that our building trades members perform during their 20, 30, and 40-year careers are very physically demanding, and when they decide to retire, they should be able to receive what they worked for. They not only work for these benefits, they truly deserve the most they can get from our Social Security system, our Medicare system, as well as our Medicaid system. These benefits for our middle class should never be cut under any circumstances, but certainly not so Congress can waste more money on tax cuts for the rich 2%ers. So in the next couple of weeks, please contact our legislator, Kathy, and countersink this message as much as possible.
I'm John Driscoll, and I've spent my whole career as an adult here in Spokane working on making sure people get the health care they need and they deserve. And like Tim, I'm concerned. We have a crisis now. We have uninsured people, we have underinsured people, we have Medicare and Medicaid recipients that really don't have access today, don't get the health care they need, and we're trying to fix that. I want to tell you, this crisis has been going on forever. My father was a physician. He started practice here in Spokane in 1964 when Medicare just began, and he told me this story his entire life. The first year he was in practice, Medicare did not exist. He bankrupted 4 families because the breadwinner had a major illness. 4 families became bankrupt. It bothered my father his entire life. He said, after Medicare began, I never bankrupted any family ever again. And that's the way it should be. Healthcare should not bankrupt us.
Good morning. Buenos dias, aho. Hello. It doesn't matter who we are. We all want to live and save our health. With the election over, Congressional rep will return to Washington, D.C. During the lame duck session, some legislators are pushing what they call a grand design bargain, what he said. That would raise the retirement age for Social Security and Medicaid and Medicare and lose our Medicaid benefits. Why? To pay for the outrageous tax benefits for the richest 2% of the Americans. There are many of us who are struggling with our health. Many don't have medical insurance or sometimes jobs. We want to tell Kathy Rogers that we oppose benefit cuts for the social safety nets and oppose more tax breaks for the richest 2% of the Americans. We don't want to lose our native health, our CHAS, or any other type of health program. Kathy, show me you care. I am just a human being trying to make it in a world that is rapidly losing the understanding of being human. We have struggled, we have fought, but we will never give up.